breaking news today.
Please subscribe and then check notification box to get all breaking news alerts.
The great state of Kentucky has confirmed on Friday that it will be the first state to make use of Thursday's guidelines from the Centers for Medicare and Medicaid Services, which will permit states to test work requirements for Medicaid recipients. Kentucky applied for permission to do this back in 2016, and the Republican governor from Kentucky, Matt Bevin, said the Community Engagement and Employment Initiative will be gradually phased in later this year. The rules will require all able-bodied adult Medicaid recipients from the ages of 19 to 64 to engage in at least 80 hours of employment activities per month, or 20 hours per week. These activities would include jobs, community service, education, and job training. And of course, exceptions for health reasons will also be taken into consideration, along with family commitments, and personal history will apply. Commitments which would qualify would be pregnant women and people who are the primary caregiver of a dependent. Kentuckians will also be required to pay up to $15 a month for their health insurance, which would not include basic dental and vision care. However, those benefits can be earned back through a rewards program, such as getting an annual physical, completing a diabetes or weight management course, or participating in an anti-smoking program. Governor Bevin, in a statement on Friday, said that Kentucky will now lead on this issue and argued that Kentuckians will now be afforded the dignity associated with being able to earn and have some level of engagement in the very things they're receiving. Via Fox News. Trump administration opens door to allowing Medicaid work requirements. The Trump administration announced Thursday that it will open the door for states to impose work requirements for Medicaid recipients, in a major shift that could affect millions of low-income people receiving benefits. The Centers for Medicare and Medicaid Services described the decision as a response to requests from states to test work requirement programs. Medicaid needs to be more flexible so that states can best address the needs of this population. Our fundamental goal is to make a positive and lasting difference in the health and wellness of our beneficiaries, and today's announcement is a step in that direction, CMS Administrator Seema Verna said in a statement. A letter sent to state Medicaid directors Thursday said the move would help improve Medicaid enrollee health and well-being through incentivizing work and community engagement. Our policy guidance was in response to states that asked us for the flexibility they'd need to improve their programs and to help people in achieving greater well-being and self-sufficiency, Verma said, noting the agency has received demonstration project proposals from 10 states: Arizona, Arkansas, Indiana, Kansas, Kentucky, Maine, New Hampshire, North Carolina, Utah, and Wisconsin. The test programs, according to CMS, could make work, skills training, education, job search, volunteering, or caregiving a requirement for Medicaid for able-bodied, working-age adults. It would not apply to those getting benefits due to a disability, elderly beneficiaries, children, and pregnant women. The move was pitched as an effort to turn the page for states in the Medicaid program, to give them more freedom to design innovative programs and results, and to remove bureaucratic barriers. The plan will likely face a political battle, which could lead to legal challenges for the Trump administration over concerns